Good evening, folks. Now, discussion C tonight has to deal with U.S. communities adapting, aging. Let's see, populations are aging faster than communities can keep up. So let me enlighten everybody with the presentation I made for you tonight. Please sit back and enjoy. Your neighborhood might not be keeping up, and the data backs that up. The U.S. is aging faster than most local communities are adapting, and the gap between what older adults need and what neighborhoods provide is widening. The core issue, aging is changing, but many places are still built for a population that no longer exists. What's changing fast? Older adults will outnumber children by 2034, a demographic shift without precedent in U.S. history. Most people want to age in place, but nearly half of adults 50 plus doubt their community will meet their needs as they grow older. Communities that are preparing, those participating in AARP's livability index, show measurable improvements in transportation, housing, and civic engagement, but tens of thousands of other places lag behind. Where neighborhoods are falling behind, housing affordability and accessibility, high housing costs, property taxes, and lack of accessible homes push many older adults to consider moving, even when they don't want to. Long-term care infrastructure. Demand for home-based support is skyrocketing, but the workforce and services aren't keeping pace. Many communities lack affordable, reliable, long-term care options. Caregiving support. Over 90% of community associations lack formal caregiving resources, leaving older adults in neighborhoods to fill the gaps. Informally, health and transportation access. Rural and low-income areas, including many small towns, face the steepest challenges in providing accessible health care and mobility options. Why this matters for your neighborhood. If your community isn't updating its housing, transportation, and support systems, older adults may face increased isolation, high health risks, financial strain, difficulty staying in their homes, reduced independence. And because Meadville is a small city with rural surroundings, this national trend is hitting even harder. Rural communities are among the least prepared for the aging wave. What forward-thinking neighborhoods are doing: redesigning housing, encouraging accessory dwelling units or ADUs, retrofits, and mixed age developments. Expanding mobility options, walkability, putting routine supports out of reach for many middle income households, fragmentation, healthcare, social services, transportation, and housing supports operate in silos, forcing older adults and families to navigate a maze. Workforce shortages, home health aides, personal care workers, geriatricians, and community-based providers are in short supply, and the pipeline is shrinking due to low wages and high burnout. The authors argue that without systematic reform, the U.S. will face a widening gap between what older adults need and what communities can deliver. Key findings, the big takeaways: demographic pressure is accelerating. By 2034, adults age 65 plus will outnumber children under 18, a first in US history. Demand for LTSS will surge. Two barriers dominate: lack of affordable home and community-based services, a shrinking, underpaid workforce, unable to meet rising needs. Equity gaps are widening. Access to LTSS varies dramatically by income, race, geography, and family structure. Rural and low income communities face the steepest deflects. Financing is the missing piece. The U.S. has no national long-term care insurance program, and Medicaid, the largest LTSS payer, only helps after people spend down their assets. Family caregivers are carrying the system, but they are aging too, and many have fewer children or live further from relatives and previous generations. What this means for Meadville and smaller communities. Smaller cities and rural regions like Meadville still at the epicenter of the challenge. Fewer providers. Rural areas often have only one or two home agencies, if any. Travel time makes staffing even harder. Higher caregiver strain. Families shoulder more responsibility because formal services are limited. Aging housing shock. Older homes often need accessibility upgrades, but retrofits are expensive and grant programs are limited. Transportation deserts. Without reliable transit, even basic errands or medical appointments become barriers to independence. Limited medical specialties, geriatricians, dementia specialists, and rehab providers are scarce outside metro areas. In short, Meadville is aging faster than its care infrastructure is growing. Practical actions communities can take now. Each of these is a concrete step that local governments, nonprofits, and coalitions can implement even without sweeping federal reform. A map local LTSS capacity, inventory, home health care agencies, adult day programs, transportation options, caregiver supports, and housing accessibility. Invest in the workforce, wage supplements, training partnerships with community colleges, and caregiver apprenticeships can stabilize staffing, expand affordable housing options, ADU friendly zoning, retrofit grants, and property tax relief for accessibility upgrades. Coordinate services, one stop aging hubs, mobile clinics, and integrated care navigators. Reduce fragmentation. Support family caregivers, respite programs, Training and small stipends can prevent burnout. Risks, trade-offs, and challenges. Funding, reliability, or funding instability. Many local programs rely on workforce retention. Raising wages helps, but without career ladders, benefits, and predictable schedules, turnover remains high. Equity blind spots. Without international design, new programs may still miss low income, rural, or socially isolated older adults. Housing barriers, ADUs, and retrofits require zoning changes. Contractor availability and homeowner financing, all heavy lifts in small towns. Tonight, I will be on tomorrow for more shows. So everybody have a nice evening. For now, Gator Wellness, take care, folks.